True success is not in the learning, but in its application to the benefit of mankind. For Thailand, non-communicable diseases (NCDs) are a major health problem that all relevant sectors have been aware of and attached importance to it continually until today. At present, efforts for addressing the problem focus on multi-sectoral collaboration to ensure efficient, timely, and integrated actions that will lead to learning towards people's well-being. Community leadership in health promotion for NCD prevention and control. On the bank of the Tajin River in Phran District, Nakhon Pathom Province, adjacent to the west of Bangkok, there was a story about the management of non-communicable diseases, or NCDs, in Yai Cha Sub District, or Tambon Yai Cha in Thai. This morning, what are these elderly people doing? They are standing in rows and paying respect to the national anthem, like a morning assembly ritual of Thai school children. Mahidol Yai Cha is the name of a school for older persons in this sub-district. The school is run by the Yai Cha Sub District Administrative Organization, or Yai Cha SAO, under the Ministry of Interior. One of the activities here is organized by the elderly to meet each other and learn about many things that help improve their physical and mental capacities. As for health, today there are many resource persons from Phran Hospital, a district-level hospital, and Yai Cha Sub-District or Tambon Health Promoting Hospital, Yai Cha THPH, jointly organizing the activities together with local residents and volunteers. Most of these older persons are members of the Elders Club, supported by the Yai Cha SAO. That reflects the role of the local administrative organization in caring for, developing, and improving the quality of life of local residents. Prayong Ditsathan, elderly person. They have invited a resource person to give a talk for us. Then we have learned about eating behaviors, living a good life, and exercise. We can use such knowledge at home. Sometime we take turn sharing our own knowledge on different things for our club. No need to hire other resource persons from outside. Importantly, after having lunch together, we will make home visits and give some food carriers, or food pinto in Thai, to our club members who are sick and cannot attend the meeting today. Police Colonel Niwed Nanta Kasikon, Chairperson, Yai Cha Elders Club. We happily give the food carriers with good wishes to the receivers. This is to show them our encouragements so that they will feel better, recover from illness faster, and join the club meeting again. They feel very glad as we do not neglect them. Most of them will have a better recovery. Payom Kanda, member, Yai Cha Elders Club. Upon meeting with the visitors, I feel glad and encouraged. Sometime I can sit up and talk with them, and then do something. Today, at the office of the Yai Cha SAO, a health meeting is held for SAO officials, local health officials, members of the Volunteers Club, Village Health Volunteers, Elders Club members, and other civic sector representatives in the locality. The meeting discusses NCD-related health issues, based on the multi-sectoral cooperation approach to seek ways to resolve such problems, thinking and practicing together as per people's real needs.
ติดต่อไม่เหลือรังหรือโรคเลือด
Mrs. Wasana Glin Payom, Chief Executive, Yai Cha Sub District Administrative Organization. This is a semi-urban society. Some part has been urbanized. The incidence of NCDs is rising, which will be problematic if we don't start tackling it now. We are using the community for community concept on a pilot scale. The people have to take care of themselves first, and then we will seek mentoring support, including additional funding, knowledge, and others from relevant state agencies. Such things are required only for community self-care purposes.
ชุมชนค่ะโดยเริ่มจากนายก
Meanwhile, we also run a home visit program for homebound or bedbound patients in the community. Undertaken by caregivers, local volunteers, and village health volunteers. The visit is coordinated and supported by officials from the Yai Cha Sub District or Tambon Health Promoting Hospital, who take turns supervising the effort. Funding for this activity is received from various sources, such as the Sub-District Administrative Organization, the National Health Security Office, and private sector agencies.
แล้วก็สามารถที่จะตรวจรักษาโรคได้
Mrs. Wasana Glin Payom, Chief Executive, Yai Cha Sub District Administrative Organization. The budget is important, but not most important. No matter how much it is, it will never be sufficient if the people only have a recipient mindset. We have to help them to properly know about food safety and healthcare through practicing by themselves. And each of the budget amounts has to be used most effectively.
ถ้าเห็นต้องส่งต่อโรงพยาบาล
Another factor that is important for NCD patient care is having caregivers and local volunteers to support patients' relatives in the care provision. The aim is for the patients to recover faster. For example, this aunt or older person could not help herself originally, but after receiving continuous caregiving support, she is now able to help herself to the level satisfactory to all concerned. Caregiver volunteer. Initially, the patient was disheartened, so the primary care team was consulted to seek ways for her mental rehabilitation so that the patient could cooperate. We had to meet with the patient every day until she agreed to take the rehabilitation program. This has inspired the patient's relative to become a caregiver and volunteer to help society.
อาจจะมีความแตกต่าง
Chairperson, Local Volunteers Club. Volunteers will normally help in the area where health officials are insufficient. We have been trained to give simple care and help with physical rehabilitation. The patient's mental health condition is most important. When a person is sick, he or she will feel down immediately. When there is someone coming in to give encouragement or visit, he or she will feel happy with willpower for self-recuperation.
ดูแลคนทั้งประเทศ
Another important agency is Yai Cha Sub District Health Promoting Hospital under the Ministry of Public Health. It is a primary care unit in the locality responsible for resolving NCD problems. Their work involves health promotion, disease prevention, treatment, and rehabilitation through collaboration with relevant agencies, enhancing the capacities of caregivers, local volunteers, and village health volunteers. This is to help them to be able to care for NCD patients, support disease surveillance activities, and coordinate with the Yai Cha Sub District Administrative Organization. 1 Pen, Director, Yai Cha Sub District Health Promoting Hospital. Director, Yai Cha Sub District Health Promoting Hospital. But how can we decrease the number of NCD patients? As for those who have had such illnesses, more patients should be able to access the medical treatment system without any complications. So, we have to work proactively in cooperation with all other relevant units.
เข้าสู่ภาวะโรค NCD
According to the guidelines for NCD problem resolution, the factors related to food safety, as well as adequate vegetable and fruit consumption, are key to avoiding NCDs. Yai Cha Sub District Administrative Organization has issued a policy for local residents to be aware of such risk factors. The communities in the sub-district have been supported to work under the Phran model on producing safe food, including organic vegetables. For example, today's Happy Society event is pushing organic society towards a balanced livelihood. That kind of work requires community collaboration, from which everyone will learn through networking.
เหมือนอย่างทางเทศบาล
Chief Executive, Yai Cha Sub District Administrative Organization. When we began changing such factors, we have seen positive responses from older persons, patients, and local volunteers, making us realize that the community for community approach can be really implemented by the community. So having the people do things for themselves would be more sustainable.
มันไม่ใช่ปรับแค่สุขภาพจิต